Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
The All of Us research program aims to build one of the largest health databases in history. But an OIG audit found weaknesses in NIH's oversight and access controls that could put sensitive participant data at risk. Charles Summers from the HHS Office of Inspector General is here to share what needs to change to protect privacy as enrollment grows. Mr. Summers, thank you for being on the program.
Thank you, Terry, and thank you for having me here today to discuss some of the important work we're doing here at Health and Human Services.
You are doing important work, and I want to talk about this program specifically, the All of Us research program at NIH. Tell us what that's all about.
So NIH has a goal of, enrolling up 1 million plus Americans into a research program that is based around genetics and precision medicine. So it's really, the future of medicine. It's really, I think where things are headed. So instead of treating you based on age or race or any of those things, they would treat you based on genetics. So this medicine is specifically for you and would, help you better than just a guess that we get on some of it. So that's the overall goal of what NIH wants to do with this research data and research.
1 million
outputs.
people, that's a lot of folks. And genetic information is pretty personal. What is going on in terms of being able to protect participant data?
So for us at the OIGs, definitely that's one of our highest and most important things is protecting the data and securing the data, and just lending a hand as far as oversight in pointing where there is places to make improvements or recommendations to improve and secure data to requirements that are out there, as well as if we see something that just doesn't seem right. So that's our main goal, is protect that data, because it's not just their data, it's our data, and it's our parents' data, and it's American data.
What prompted you then to look at the data protection processes in this research program? Was there a red flag or something that happened?
So we've done work at NIH since I've been working here, and we kind of go through risk and things like that. So the All of Us program, which with genomic data is Office and National Council has said that this is a national security concerns with genomic data. So that's kind of, we've done other OPDIVs as well, but NIH with this program, we've done some work here in the past with the All of Us program. So we checked up on some of those findings from the past, as well as there's persistent cybersecurity and national security threats, have increased, and challenges across the board as far as technology is, and those vectors that NIH must lock down across to protect this data. So all of those combined, it's critical operations and programs that we feel are of everybody's concern, as well as partnering with HHS as far as how we're going to protect the program as a whole.
It seems like if you're going to get 1 million people to volunteer, one of the core guarantees is that their data be protected. What did you find as you got into the audit?
Absolutely. And I do want to emphasize what you said. It is core to the program, because if you lose that trust, then less people are going to join. Currently, NIH says they have over 600,000 participants already in the program enrolled. The goal is 1 million, but that's where they're currently over 600,000 already enrolled. And some of the key cybersecurity gaps that we found there was inadequate access controls, allowed access from the systems from abroad, which was employees. It's not just normal somebody trying to get access, but the employees could access that data from abroad. We also found that the system permitted the research participants to download data, even though policies and procedures restricted that and did not allow for that. In kind of both of those access controls, we like to say it's kind of like there was a warning banners that pop up to say, hey, you can't do this, but it's kind of like a door with a scary sign on it that says, hey, don't go in here. But the door's it's unlocked and you can go through it. So you could close those and go ahead and access this data and download some of this data. And that's not what we normally would see. We would want to see block it. And if there was a need for it, then you would go through the proper procedures to get it to, open those for you. And then the last two things that we found was NIH had failed to inform the Data Research Center, which was the awardee of this, that houses the data for them. They didn't I guess, inform them of the national security concerns around genomic data. So when that data research center awardee is setting up the system and kind of going through checks and balances on security controls, they set it to a certain level based on risk, in which they do the risk assessments. But NIH didn't give them that key piece of information, which could have changed where the level that maybe that security should be at, should be maybe up another notch. So that wasn't factored in when they were doing risk assessments. And lastly, we found that the Data Research Center was not remediating findings that they find themselves, as well as something that may come up from an audit or something like that, in the time requirements that align with federal requirements, and it was in the contract. So they had some different time frames, and those was agreement. It was in the system security plan, and so those were in opposition of what they had already agreed to as far as the contract.
You mentioned as you walked through those findings that the genomic database is managed by a contractor, DRC. Is that a normal thing for these kinds of research projects? And what does that say to you about the need for better oversight between HHS, NIH, and the contractor?
So yes, your point is very valid. And yes, the NIH does have the responsibility for oversight for all their contractors. And that is very typical for this type of program. In all of these large OpDivs and throughout HHS, we leverage contractors and grantees and things like that, just as the need for so much expertise in these areas. A lot of times that is where you have to go to get that much expertise, because you're needing large numbers of people. So it is very much NIH's responsibility to have that in the contracts, as well as the oversight to ensure that the proper security levels are being maintained. And I think that's noted in some of the findings there. Is, for instance, the finding of not providing them the information that genomic data is of national security concerns. So that would factor into the risk assessment, which is part of the agreement for the DRC to complete. And so without that complete information, things maybe not at the correct level. So that's definitely, the burden is on NIH for that oversight and ensuring that is taking place.
So you made 5 recommendations in this report. Are any of them, do you think, particularly urgent, and what are you hoping to see NIH do quickly to respond?
Okay. Yeah, and typically you're correct, and it's very important, I think, is we don't normally rank those findings, but our access controls kind of tend to drift to the top, because that is the gate to getting access in the system and restricting access to people you don't want in the system. For instance, the first recommendation was to enforce the restrictions for remote users. Very important to us, as we have, there's certain countries of concern, which is constantly in the news. And so we want to ensure, if people are there, we're using proper security and you have, proper approvals. And so that was one of our findings as well. And also blocking unauthorized downloads of data. So both of those around access control, very high, as well as remediating findings timely, because those are weaknesses that are there, and your time frames to remediate those, you want them to be as short as possible to close those windows of known vulnerabilities that adversaries may use to try to gain access to the system. And NIH did reply to us and respond very acceptable, and is also agreed to, I should say, concurred with all those findings as we describe it. And they have already taken actions on some actions on all these findings. And part of our tracking system is kind of where they're at, and we have time frames, and they kind of report, here's where we're at, here's what we're going to do next. And so that goes back and forth until the completion. So we ensure that those are completed.
I've been speaking with Charles Summers. He's the Assistant Director for Cybersecurity and Information Technology Audit Division in the Department of Health and Human Services, Office of the Inspector General. Mr. Summers, thanks for sharing this important report with us today.
Thank you so much, Terry.
We'll post this interview and a link to the report at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts.